Hi guys, my name is Yetty and welcome to, you know what it's called, Yetty Splash. Anyways guys, on today's episode of Yetty Splash, I'll be sharing with you everything you need to know about the UK Health and Care Worker Visa. Yes, this visa came into force 15th of February 2022 and oh my god, a lot of people have been messaging me, say something about the health and care visa. We really want to know. This visa is, that's all I can say. For those who have it, I just envy those who have already gotten it. I envy those who are planning to get the visa. But yes, in this video, everything you need to know about the health and care worker visa is what I will be sharing with us today. For starters, let me say this: not everyone will be eligible for the health and care worker visa. So who are those that are eligible for this visa? Qualified doctors, qualified nurse, health and care professional, and some adult social care professionals. These are those that are eligible for this visa. For you to qualify for this visa, you must be working in the health and social care industry in the United Kingdom, or you have received an offer from the health and social care industry in the United Kingdom. Your UK employer must be approved by the Home Office. What that really means is that your employer must possess a license or a certificate of sponsorship. You must be able to check that yes, you can do the job that they are hiring you for. So you must be earning a minimum salary of £20,480. And you must be able to demonstrate sufficient knowledge of English language. And how do you do this? You should be ready to write your UKVI IELTS test, or you get a degree assessed by NARI. How long can the health and care visa last? It can last for minimum of 3 to maximum of 5 years. That is 3 to 5 years. Can you imagine? 3 to 5 years you can stay in this UK on the health and care worker visa. And also another interesting thing about this visa is that it counts towards your stay in the UK. That means if the 5 years is over and you still decide to stay in the UK, then you can apply for indefinite leave to remain in the UK, which is more or less like a permanent residency in the UK. So this visa allows for settlement path in the UK basically. So how do you apply for this visa? There are 4 categories of people that can apply for this visa. Number 1, you can apply for this visa if you're outside the UK and you're thinking of coming to work in the UK, of course in the required sector. That is 1. Then number 2, apply for this visa if you're extending your current visa. Number 3, you can apply for this visa if you're in the UK on a particular visa and you're switching to this visa. That is like, I'm an international student now. If I am in the health and care sector, or I did work in the health and care sector while I was in the UK, then I can apply to switch from the student visa to this particular visa. I hope you get that. Also, you can apply for this visa if you're changing jobs. Let me explain it for you. If you're on this health and care worker visa, for instance, for 3 to 4 years and you already have the visa, if you can't leave that job, you must work with them for that long, or you apply for another job that will then sponsor you. So if you're switching visa, then you have to update the visa. You cannot work for another company with the healthcare visa that they sponsored you on. You can't work for another company. If company A is sponsoring you, then you have to work with company A for 5 years. But if you want to switch to company B, then you must apply for this visa to switch to company B. I hope you get that. So these are the 4 categories of people that can actually apply for the health and care visa. And the interesting thing about this visa is that your spouse, your husband, your wife, your children can also move with you to the UK and be under this visa as well. So as long as you're in the UK for like 5 years, they can also come to the UK and work for 5 years, and your spouse can apply for any other job. I don't know if you get it. Your spouse must not be working in the health and care sector because you're on the health and care visa. Your dependent can actually do another thing entirely from this visa. So you can bring in your dependent to come also and stay with you in the UK with this visa. So when can can you apply for this visa? You can apply for this visa up to 3 months to your start date as stated on your offer letter. You can make an application by that time, and you should get a decision within 3 weeks. But what people are saying, people that have applied for this visa and have gotten it, is that they even get their decision within a week, because the UK really needs people, so they are on the priority list without even actually paying for priority. Then another perk of this visa is that you are not required to pay IHS, that is the immigration health surcharge fee at all, which is amazing and fantastic. So you're not supposed to pay any IHS fees if you're on this visa. And sometimes most people on this visa, they are being sponsored by their employer, so the employers usually cover all the costs for this visa. Isn't that amazing? Like, and your dependents as well, they won't pay immigration health surcharge. So you might also need to, prove that you have sufficient funds to maintain yourself. So you need to have about you need to have about £1,270 in your account for a minimum of 28 days if you're applying for this visa. So the application fee for this visa varies on whether you're applying for 3 years or applying for more than 3 years. If you're applying for 3 years, you pay £222. And if you're applying for more than 3 years, from 3 to 5 years, you have to pay £464 as your application fee. So if your partner, that is your wife, if your wife or husband is also applying on this visa with you, like, they will have to pay. For your partner, it is £285, and if you guys have children, for your first child, you pay £315 for one child. Then subsequent children or subsequent child will pay £200, so additional £200 per child. But the first one will pay £315. What are the documents that you need to apply for this visa? The very first thing, you need your certificate of sponsorship from your employer. Your employer has to provide you with a reference number, so you need a certificate of sponsorship reference number from your employer. That is one. You need a tuberculosis test result, that is if you are coming from countries that require tuberculosis test results. You also need a valid passport. Obviously, that goes without saying. If you're applying for anything, you actually need an international passport. And then you need your your proof of English language. If you're from certain countries like Canada, Australia, you do not need to write an English language test. Some English speaking country like Americas, they are not allowed to, they don't require them to write English language test. But if you're coming from other countries, like if you're a Nigerian, then you need to prove your knowledge of English. I've said before, you can prove this either by writing a UKVI IELTS test or getting your degree assessed by NARIC. NARIC is a body in the United Kingdom that can assess your degree, and if they find it satisfactory enough, then you do not have to write the English language test. Also need a job offer and the title of your job, a job title, and your annual salary. So basically, you need your offer letter if you want to apply for this visa. You need your job occupational code. So if you're coming in as a nurse or an healthcare assistant or a doctor, so each job, basically, they have their code. You need your occupation code as well. You need the name of your employer and their sponsor license number. You need the proof of your maintenance fund, that is more or less your bank statement. If you're applying to be a dependent, then you need your marriage certificate, and if your child is also coming, you need a birth certificate for the child to also prove that the child is your child. You know what I mean? So if you're working with vulnerable people, then you need to get a criminal record certificate, more or less like a police report or something like that. A criminal record certificate from any country you've lived in for 12 months or more in the last 10 years, especially if you'll be working with vulnerable people. So what are the things that you cannot do on this visa? You cannot apply for public funds on this visa. You cannot apply for state pension scheme on this visa. You cannot change your job on this visa unless that job is also going to sponsor you, and then you have to apply to also switch to the new job, sponsorship certificate or things like that. But you can't just change your job on this visa. If it is company A that is sponsoring you, then you have to work with them for 5 years. Or if you change, just be sure that other job is also sponsoring you, because if they're not sponsoring you, then you can't use company A sponsorship to work for company B. So these are just the minor things that you cannot do on this visa. Generally speaking, the health and care worker visa is a point-based visa, just like the student visa. But what you need is 70 points for this visa. And The first 50 points is for attributes, which include getting a valid certificate of sponsorship. So once you have that certificate of sponsorship reference number, that is 50 points. Then the 10 points is for maintenance. Once you're sure that yes, you have enough funds to maintain yourself for the time being, you get 10 points. Then your ability, your knowledge of English language is also another 10 points. So it's a 70 points based visa process. So how do you apply for this visa? Go through to gov.uk website. You see the link on how to apply there. Once you get the link to apply, I'm also going to put the link in the description box in my video. So once you get the link to apply, it's very simple. You start your application, you select Tier 2, then you select that you're applying for health and care visa. Fill out the form, your reference number, your name, everything they'll ask you. Once you have all these documents, it's very easy. You don't need to get anybody to apply for you. It's very, 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 very easy to apply. And a lot of people have been applying for this visa, especially international students. Because, see, now, let me just advise you, if you're coming to the UK now, it's best for you, even though you're having like a master's in anything you're doing your master's in. If you know that your main goal is to just jackpot and you really don't mind, you're not passionate about what you want to be in life. Some people are like that, like they just want to live happy life, they don't really mind. You can just come to the UK, study what you want to study. Then once you're studying what you're studying, apply for a part-time job in the health and care sector or the adult social care sector. Once you apply for a part-time job there, you're just doing your thing. By the time you are done, instead of applying for the post-study work visa that absolutely does not count towards your immigration, and you spend almost 2,800 or 2,500 pounds to apply for, and it still doesn't count as part of your immigration, you just apply for this, get a job and apply for this health and care worker visa and stay in the UK for 5 years. Then after that, you apply for your indefinite leave to remain. Then you can bullshit the health and care job and pursue your goal or your passion or what you really want to. If you can afford to do that for 5 years. In life, it all depends on what you want, really. I wish I could take this advice, but I can't. But it is what it is. Anyways, guys, I hope you enjoyed today's video. Like I said, please, I need you to subscribe to my channel for more amazing content like this. And you know I already love you guys, my returning subscribers. You guys are the bomb. And if you're new here, welcome to the world of Yetty, where I spill all the gist about living in the United Kingdom. I love you guys so much. Until we meet again, stay blessed. Bye.